good morning, everybody. My name is Tenu Avafia. I'm the Unité Deputy Executive Director, and my colleague Matthew works with the External Relations Department. So I'm definitely one of the newer, how can I say, new to the terminology, so to speak, but very happy to be here and to share a bit about our story. So by way of quick introduction, Unité does two things. We help to bring to market missing treatments where there are unmet health needs and the market does not incentivize their development. And the second thing, where we really focus, is on accelerating or optimizing the introduction of new technologies, tests, therapeutics predominantly into LMIC markets. And by doing it as efficiently and as quickly as possible, breaking down barriers. And by doing that, we help to save time, we help to save money, and ultimately it results in saving lives. For the last several years of Unité's existence, we have focused on HIV, TB, malaria. We have a very synergistic relationship with the Global Fund, for example, because we help to break down the barriers of entering a market, and the Global Fund comes with the heft, the investment, or it can also be PEPFAR, that helps to scale up. And so we have this relationship with the fund where, for example, our work on HIV treatment, dolutegravir has resulted in about $1 billion a year of savings. Unité has expanded into more niche areas, including women and children's health, domestic and regional manufacturing, climate and health. And I want to go back to the women and children's health piece. We work in postpartum hemorrhage, preeclampsia, and cervical cancer. Cervical cancer, we've been making investments for the last 4 years or so. The investments, given the scale of what we do, at the moment we are an organization that disburses about $250 million a year. The cervical cancer investments are quite modest. So far we've invested about $70 million. We focus on prevention, screening, and then also treatment of precancerous lesions, thermal ablation devices. We have been working in 14 countries in 3 continents. And we have managed to get about 1.2 million women screened in these countries. So not a massive impact, but still an important one for what is a very neglected space internationally. Now, unlike HIV, TB, malaria, where you have these large investors that come in with the heft, because cervical cancer is a space that doesn't attract the same level of investment, we're interested in looking at sustainable financing and other innovative forms of financing as a way of leveraging impact, because the investment, I mean, it speaks for itself in terms of what we invest and what the impact, the health impact is. But this is a space that we think is one that we'd like to start a conversation with like-minded allies.